limb consists of the gluteal region, the thigh, knee and leg, and the ankle and foot. The first topic to be tackled is the gluteal region. Under the gluteal region, we have cutaneous nerves, upper anterior part from subcostal and iliohypogastric nerves, upper posterior part from posterior rami of L1, 2, 3, and S1, 2, 3, lower anterior part from posterior division of lateral cutaneous nerve of thigh. Simply, the cutaneous nerves are nerves that provide nerve supply to the skin. Other terms that fall under the cutaneous nerves are the cutaneous arterial supply, which are branches from superior and inferior gluteal arteries, cutaneous lymphatic drainage, lateral group of superficial inguinal lymph nodes, and deep fascia, which lies above and in front of gluteus medius, which is thick, but over gluteus maximus it is thin. The deep fascia splits and encloses gluteus maximus. This is an illustration of the muscles of gluteal region in which different lymphatic vessels and neurovascular structures are present. The muscles of the gluteal region can be broadly divided into two groups: superficial abductors and extenders, which are a group of large muscles that abduct and extend the femur. It includes the gluteus maximus, gluteus medius, gluteus minimus, and tensor fasciae latae. And the deep lateral rotators, which are a group of smaller muscles that mainly act to laterally rotate the femur. It includes the quadratus femoris, piriformis, gemellus superior, gemellus inferior, and obturator interna. The tables shown are the muscles of the gluteal region, which are the gluteus maximus, gluteus medius, gluteus minimus, tensor fasciae latae, piriformis, obturator internus, gemellus superior, gemellus inferior, and quadratus femoris, and their corresponding origin, insertion, nerve supply, nerve root, and action. Arterial anastomosis in gluteal region. Cruciate anastomosis, present in the lower part of the gluteal region. Arteries taking part are anastomotic branches of inferior gluteal artery, first perforating artery, and transverse branches of lateral and medial femoral artery. And the second one is a trochanteric artery, seen in relation to greater trochanter artery. Taking part in anastomosis are descending branches of superior gluteal artery, ascending branch of medial and lateral femoral arteries, and nerves in gluteal region. Nerves in gluteal region. Structures passing through greater sciatic foramen, structures passing above the piriformis or superior gluteal nerve and superior gluteal vessels. Structures passing below the piriformis are inferior gluteal nerve, inferior gluteal vessels, sciatic nerve, posterior cutaneous nerve of thigh, nerve to quadratus femoris, pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Structures passing through lesser sciatic foramen are pudendal nerve, internal pudendal vessels, nerve to obturator internus, and tendon of obturator internus. IM injection is given in superolateral quadrant of gluteal region to avoid injury to nerves. Moving on to the thigh. The front and medial aspects of thigh. Lateral cutaneous nerve of thigh, which is a branch of lumbar that supplies the skin of the lateral aspect of the thigh and lower lateral quadrant of the buttock. Femoral branch of the genitofemoral nerve, a branch that supplies a small area of skin. The ilioinguinal nerve, a branch of the lumbar plexus through the superficial inguinal ring. Medial cutaneous nerve of the thigh, a branch that supplies the medial aspect of the thigh. Intermediate cutaneous nerve of the thigh, a branch that divides into two branches that supply the anterior and joins the patellar plexus. Branches of anterior division of the obturator nerve on the medial aspect of the thigh, and the patellar plexus, which lies in front of the knee. This is an illustration that shows the frontal and medial aspects of the thigh. Superficial veins of the leg are the great and small saphenous veins and their tributaries. Great saphenous vein drains the medial end of the dorsal venous arch of the foot and passes upward directly in front of the medial malleolus. 3 tributaries: superficial circumflex iliac vein, superficial epigastric vein, and superficial external pudendal vein. Small saphenous vein arises from the lateral part of the dorsal venous arch of foot and it drains the leg's lateral surface. Inguinal lymph nodes. Superficial inguinal lymph nodes lie in the superior fascia below the inguinal ligament and can be divided into horizontal and vertical groups. Horizontal groups lie just below and parallel to the inguinal ligament, whereas vertical group lies along the terminal part of the great saphenous vein. Deep inguinal lymph nodes are nodes located beneath the deep fascia and lie along the medial side of the femoral vein. The superficial fascia of thigh. Membranous layer of superficial fascia of the anterior abdominal wall extends into the thigh and is attached to the deep fascia about finger breadth below the inguinal ligament. Fatty layer of the superficial fascia on the anterior abdominal wall extends into the thigh and continues over the lower limb without interruption. The deep fascia of thigh encloses the thigh at its upper end and is attached to the pelvis and the linguinal ligament. Under the deep fascia of thigh are the lateral aspect and the gluteal region. The lateral aspect, in which the iliotibial tract can be found, and the gluteal region, where the deep fascia forms sheaths. The saphenous opening is a gap in the deep fascia, and under the saphenous opening there is falciform margin, which is the lower lateral border of the opening, and the cribriform fascia, which is the loose collective tissue that fills the saphenous opening. Muscles of the anterior fascial compartment of the thigh. So there are three major muscles in the anterior thigh, the pectineus, sartorius, and quadriceps femoris. In addition to these, the end of the iliopsoas muscle passes into the anterior compartment. Arterial supply. Femoral artery is the main arterial supply to the lower limb. Its branches consist of superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery, deep external pudendal artery, profunda femoris artery, and descending genicular artery. This is an illustration of the medial fascial compartment of thigh. So the muscles that lie on the medial fascial compartment of thigh are gracilis, adductor longus, adductor brevis, adductor magnus, and obturator externus, with their corresponding origin, insertion, nerve supply, nerve root, and action. This one is the posterior fascial component of thigh, which illustrates the following muscles: biceps femoris, semitendinosus, semimembranosus, adductor magnus, with their corresponding origin, insertion, nerve supply, nerve root, and action. Hip joint. The hip joint is the articulation between the hemispherical head of the femur and the cup-shaped acetabulum of hip bone. The type of hip joint is a synovial ball and socket joint. Being a ball and socket joint, the hip joint permits movements in 3 degrees of freedom: flexion, extension, abduction, adduction, external rotation, internal rotation, and circumduction. The following ligaments of the hip joint are iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, transverse acetabular ligament, and ligament of the head of femur. The nerve supply of the hip joint include femoral nerve, obturator nerve, sciatic nerve, and nerve to quad. And again, the movements of the hip joints permit flexion, extension, abduction, adduction, lateral rotation, and medial rotation. Moving on to the knee and leg. Bones of the leg. The leg is the part of the lower limb between the knee joint and the ankle joint. The leg bones are the strongest long bones as they support the rest of the body. So these are the following bones that make up the leg: patella, which is the largest sesamoid bone, tibia, which is the large weight-bearing medial bone of the leg, and fibula, which is the slender lateral bone of the leg. This is an illustration of the structure in the anterior fascial compartment of the leg, which includes nerves and arteries. There are 5 main muscles in the anterior compartment of the leg, which are the tibialis anterior, which is located alongside the lateral surface of the tibia, extensor digitorum longus, which lies lateral and deep to the tibialis anterior, peroneus tertius, which is on the front of the lower leg, extensor hallucis longus, located deep to the extensor digitorum longus and tibialis anterior, and the extensor digitorum brevis, which arises from the upper and lateral surface of the calcaneus, the floor of tarsal sinus, the talocalcaneal ligament, and the stem of the inferior extensory retinaculum. Muscles of the lateral fascial compartment of the leg. So there are only 2 of them, peroneus longus and peroneus brevis. Muscles of the posterior fascial compartment of the leg. The posterior compartment of the leg contains 5 muscles organized into 2 layers, superficial and deep. The 2 layers are separated by a band of fascia. The posterior leg is the largest of the 3 compartments. Collectively, the muscles in this area plantar flex and invert the foot. They are innervated by the tibial nerve, a terminal branch of the sciatic nerve. Muscles of the posterior fascial compartment of the leg include gastrocnemius, plantaris, soleus, popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. The knee joint. The knee joint is the largest and most complicated joint in the body. The knee joint is a synovial joint that connects 3 bones, the femur, tibia, and patella. It is a complex hinge joint composed of 2 articulations, the tibiofemoral joint and patellofemoral joint. Proximal tibiofibular joint. Articulation is between the lateral condyle of the tibia and the head of the fibula. The articular surfaces are flattened and covered by hyaline cartilage. Distal tibiofibular joint. Articulation is between the fibular notch at the lower end of the tibia and the lower end of the fibula. The opposed bony surfaces are roughened. The last section of the lower limb is the ankle and foot. Bones of the foot. The bones of the foot are the tarsal bones, the metatarsals, and the phalanges. The bones of the foot provide mechanical support for the soft tissues, helping the foot withstand the weight of the body while standing and in motion. They are divided into 3 groups. Tarsals, which are a set of 7 irregularly shaped bones. They are situated proximally in the foot in the ankle area. Metatarsals, they connect the phalanges to the tarsals. Phalanges, the bones of the toes. Each toe has 3 phalanges, proximal, intermediate, and distal, except the big toe, which only has 2 phalanges. The tarsal bones. The tarsal bones are the calcaneum, the talus, the navicular, the cuboid, and the 3 cuneiform bones. Only the talus articulates with the tibia and the fibula at the ankle joint. This is a type of tarsal which is the calcaneum. This is the largest of the tarsal bones. It forms the heel and articulates with the cuboid anteriorly and the talus superiorly. The foot. The foot supports the body weight and provides leverage for walking and running. It is unique in that it is constructed in the form of arches, which enable it to adapt its shape to uneven surfaces. Long tendons of the sole of foot include flexor digitorum longus tendon and flexor hallucis longus tendon. Arteries of the sole of foot: medial plantar artery, lateral plantar artery, and dorsalis pedis artery. Nerve of the sole of foot: medial plantar nerve and lateral plantar nerve. The table shown is about the muscles of the sole of foot. The first layer contains abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. The second layer contains quadratus plantae, lumbricals, and flexor digitorum longus tendon. The third layer includes flexor hallucis brevis, adductor hallucis, and flexor digiti minimi brevis. And the fourth or the last layer contains interossei, dorsal, plantar, peroneus longus tendon, and tibialis posterior tendon.